Hi there, I'm Emily Goldberg, a genetic counselor with jscreen. Today, let's chat about preconception genetic testing. It's a big term, but don't worry, we'll break it down together. So what exactly is preconception genetic testing? Well, it's a way to check for genetic risks before you start trying for a baby. Why would someone want this test? It's all about planning ahead. This test can tell you if you or your partner are carriers of genetic changes that could affect your future child's health. Now, you might be wondering, what does it mean to be a carrier? Great question. Being a carrier means you have a change in a gene, but it doesn't typically affect your health. However, if both you and your partner are carriers for the same recessive condition, your child might be affected. What kind of conditions are we talking about? The test looks for many different genetic disorders. Some you might have heard of, like cystic fibrosis or sickle cell anemia. Others might be less familiar to you. How does the test work? It's pretty simple. Usually it's just a blood test or saliva sample. When should you consider this test? Ideally before you start trying for a baby. This gives you time to understand the results and consider your options. Speaking of results, what happens if the test finds something? First, don't panic. Remember, being a carrier is common and doesn't mean your child will definitely have a genetic condition. If both you and your partner are carriers for the same recessive condition, you have options. You might consider prenatal diagnosis in a pregnancy, or you can think about IVF with genetic testing of embryos, using donor eggs or sperm, or adoption. It's important to remember that preconception genetic testing can't guarantee a healthy baby, but it can give you valuable information as you plan your family. If you're thinking about starting a family and want to learn more about preconception genetic testing, visit jscreen.org for more information.